Thank you very much for joining me on this Sunday morning. It's lovely here in Dublin, so I appreciate your being here. You'll see that the title of my talk is Planting the Seed. It actually comes from a herbal formula that's used called opening the uterus and planting the seed. And I use it deliberately because all we do, not all we do, but everything we do is directed towards increasing the possibility of conception. I'm going to start with, the Irish love to tell stories, so I'm going to start with two stories. And then I'm going to explain a little bit about why I ended up spending 10 years of my life trying to get this book together. So the first story is to do with the fact that when I was at a conference with my colleagues in Dublin, I did a vox pop. I asked how many of them specialized in fertility, and their answer was, oh, no, I don't do that. I don't do that. I keep that to 5 to 10% of my practice. And that was actually a fairly universal answer. I was surprised by how universal the answer was. And the second incident came when I asked a colleague of mine what he did when a patient talked to him about being given a diagnosis of a low AMH, and he said, "Oh no, I don't talk to them about. I don't talk about that kind of stuff." So I was slightly perplexed and thought about it quite a bit. So the first instance is how challenging an infertility practice can be. And oops, let me see if I. Oh, sugar. Oh, my slides are, oh, here we go, sorry. Okay, how challenging an infertility practice can be because we're trying to do so many things at once. And we're interfacing not only with, sometimes with the couple, and mine is about female infertility, so it's very much focused on the woman. And we're also interfacing with the medical profession, and we're often interfacing with ART clinics, assisted reproductive technology. So it's a lot to take on, and it requires a certain kind of steadiness and endurance to do this kind of work and do it well. And it really comes back to, given that, you know, a lot of practitioners maybe don't understand what AMH means, maybe they don't understand what happens when a woman gets a diagnosis of a very low AMH or correspondingly a diagnosis of a very high AMH. So it does require a lot of knowledge, and that comes back to why I really wanted to do this book, because I was privileged enough to be able to work with Dr. Wu or watch her in the clinic in Zurich when I did the course, and I offered to help write the book, partly because I wanted to have the information that was available to me available to a larger audience. And given that we do work in a world where we face Western medicine is the dominant medical model, and we're practicing in this wonderful system of medicine, but it's not always recognized for the wonderful tool it is. And secondly, neither do we have the apprenticeship system that someone like Dr. Wu had in China. So Dr. Wu would still talk about her teacher and her teacher's liking for particular herbs because she's primarily a herbalist. And so I wanted this information. I really, really worked hard to try and get this information as clear as possible, because I wanted people to have access to this, the complexity and the beauty of a system that could not only help in the treatment of infertility, but help in the treatment of so many gynecological disorders that really, really are difficult, embarrassing, and painful for women. So I really wanted to be there. I wanted the information. We spent a lot of time organizing the material so it would be as clear as possible for practitioners. Okay. Now I have to say, firstly, that I'm because of what I've been doing since the 1990s, and I've been using herbs. There will be some herbal material here, but the principles of how you think are the same. And I really tried to organize a talk that would talk about how we navigate our way through with clarity of thinking in order to serve our patients well. Okay, so let's see if I can get on. So let's talk about, very briefly, some of the definitions of infertility. Okay, so we know, strictly speaking, it's a failure to conceive following 1 year of unprotected sexual intercourse. And we also know, these are statistics from 2017, 1 in 7 couples will seek, two wills there, will seek medical help to conceive. Okay, and you can see the breakdown of the factors here. Male factor, 30%, which means that 30% of couples will actually, probably because of male factor, end up going for some kind of assisted reproductive technology, because whereas they can manipulate the female system, they can only wash and prep the sperm and get them and insert them into the uterus, into the vagina, and therefore into the for its progress through the uterus. And that means that when we come to the slide where I talk about what affects women, male factors there, and you can see the breakdown here of ovulatory or tubal factors together, 45%, joint factor, 40% of couples will have a joint factor, both a problem on the male side, a problem on the female side, and an unexplained 25%, which is sometimes the very hardest because there's no obvious reason. There's nothing wrong with the sperm, the motility's fine, the morphology's fine, the volume's fine. There's nothing wrong with apparently wrong with the woman. Her hormone profile is fine. She's ovulating. They might do a tracking cycle, everything's fine, and it's still, they don't manage to conceive, and it's extremely painful for extremely painful for the couple, and it causes a lot of heartache, okay? And we have, just to break it down, we have primary infertility, okay? They've never had a child. Secondary infertility, they've had a child and they want to have a second one, and it's proven really difficult. And that is both a medical and a social issue, because we'll come back to that, but it's partly also to do with the pressures on women and the pressures of the working world, which we can't ignore the structures of the working world and the commercial setup where men and women work, and the impact that has on a couple, and particularly on a woman who may have to leave work early, who may have to step back in her career in order to do the childcare, go home if a child is sick, and at the same time try and have a second child, perhaps with a certain amount of reduced resources. Okay, so we know that also, and I put this in 60, this is a statistic that comes from a presentation at the Marian Fertility Clinic where I was associated for many, many years. Okay, so 66% of couples will leave an IVF program with a baby. Now that doesn't talk about how many cycles they have to do, but if you notice, it's actually very interesting. That means that the majority, the remainder, which is 34%, which is practically a third, do not succeed with an IVF program. And it's a heartbreak. And it's also a statistic that means that people will go back, couples will go back again and again and again to try. So when I organize this material, it can be either, as Chinese medicine, can be standalone. In other words, you know, here are the ways in which we help couples have children, and I'm focusing on women today, or it can be part of what we would call the regulation process and the assistance process as a woman goes through an ART cycle, because the better the preparation, the better the outcome for the woman as she undergoes an ART cycle. Okay, so here's the definitions. But on the other hand, okay, you can see here that without any Western medical intervention, 84% of couples conceive within a year, and 93% couples conceive within 2 years. And that is definitely a factor in the clinic. Those of you who work in infertility will realize, you'll know yourself, that part of your work is to actually try to help a couple or a woman relax, give themselves the time, not move too fast, and believe in their capacity actually with enough time to have a child. Okay, so that's definitely part of your work. And secondly, we see that if women are taught how to plan intercourse precisely for the peak day in that fertile window, they can achieve, and you can see here, even those in the oldest age group, okay, achieved conception rates of up to 30%. Okay, now that's a double-edged sword, because of course it does increase the pressure on women, you know, and that whole pressure around ovulation that so many couples experience. But at the same time, it does show you how, if you spend time trying to help a woman, educate her as to her own cycle, and the same goes for men about the factors involving sperm health, then it's of a massive help to a couple in terms of conceiving. Okay, so the second reason why I wrote this book is because even though it's very much focused on reproductive endocrinology, there's a lot of information here about how to deal with cycle disorders and how to deal with pain. Okay, so we can see here, and this comes from a book called Pain and Prejudice. Okay, not all of it, but some of it. Certainly the statistic of 1 in 10 women suffer from endometriosis, and therefore with cyclical pelvic pain, and possibly an impediment to conception because it's a disorder of the immune system, And the endometrioma, those chocolate cysts, may infiltrate into the ovary and making ovulation more difficult. But they also suffer enormous pain. And endometriosis is, of course, a disease where tissue similar to that in the uterus implants itself into the pelvic cavity and responds to the hormonal signals that govern a woman's monthly cycle. And therefore, when she's bleeding outside, she's bleeding inside, and you have nowhere for that blood to go. So it tends to collect, to pool, and form the classic form we would say in blood stasis. Okay, if it happens to be inside the wall of the uterus, we have an even more severe syndrome called adenomyosis, and that's even can cause excruciating pain because literally there's nowhere for that blood to go, and we can go from adenomyosis to an adenomyoma, which is like a blood myoma inside the wall of the uterus, and it causes excruciating pain. And the only treatment in Western medicine is actually, often they would say, is a hysterectomy, whereas in Chinese medicine, at least we have access to acupuncture, we have access to herbs that are taken orally, and we've access often to a herbal enema that can go right to the tissues and to work on the area where the problem lies. Okay, so that's about treating pain. A lot of information in the book about cycle disorders and treating pain, and it's of enormous benefit, not just to women who are trying to conceive, certainly with endometriosis, but also other women who suffer pain and bleeding disorders. And secondly, the statistic, 3% of women of reproductive age have PCOS, okay? So 75% of these are said to be infertile. And we also know that if a woman is diagnosed with PCOS, and that may be because you see she's been diagnosed, or you see in her blood tests, there's an imbalance of the LH and the FSH levels, or she's got excessive testosterone, or she's been told she has the little string of pearls that indicate, along with other signs, PCOS, she has a tendency to hypertension. She has a tendency to hyperplasia, like the uterus does not shed in the way it should do, and it's not particularly good. So intervening in the situation for those women, whether they want to conceive or whether they don't, is extremely important in actually averting type 2 diabetes, averting hypertension, and averting the dangers of hyperplasia. Okay, and I just finished with two statistics here. 44% of women could not identify a vagina in a diagram, and 60% could not identify a vulva. That comes from a project called the Eve Project about the shame that is often related to the realities of female physiology. And that's also included in this wonderful book called Pain and Prejudice. Okay. So let me see if I can move on. Okay, so here we have our tools and our processes. I couldn't find a file on acupuncture, so I've used the pulse taking as a sign of how we work with the body to understand its processes and the process of making up a herbal formula. And I would actually, I know most of you are acupuncturists, or you may be acupuncturists, but I really, really would urge you, in order to treat gynecology, to think, if you're not already a herbalist, to think about becoming a herbalist, because you gain access to an enormous resource of supports in the process of gynecology and in the process of infertility, and particularly correcting cycle disorders and helping with excessive pain and bleeding. Okay. All right, so here we know that luckily we've got these fundamental patterns of female infertility. We know their deficiency and excess, kidney yang deficiency, whether it's constitutional, probably constitutional, kidney yin deficiency, could be constitutional, could be acquired. If it's accompanied by empty heat, can lead to certain cycle disorders, which can be tricky to deal with. Excess liver qi stagnation, what woman doesn't suffer from qi stagnation with the amount of stress that's involved in trying to conceive. Phlegm damp, which can be an aspect of what we talked about, PCOS, whether it's phlegm damp coexisting with kidney deficiency, phlegm damp coexisting with liver qi stagnation, phlegm damp coexisting with spleen deficiency, which gives us our classic kind of overweight profile for infertility, a long cycle and ovulation, and the ubiquitous factor of blood stasis, which can either be what we call functional or organic. A woman can have a myoma, a uterine fibroid, or she can be diagnosed with endometriosis, or functionally liver qi stagnation has led to blood stagnation and she has pelvic pain or dysmenorrhea during her cycle. Okay. And so that's a factor we have to take into account. And as you can see at the bottom, one or two patterns can coexist. So you need to establish your hierarchy, whether it's liver qi stagnation on its own, whether it's phlegm damp leading to amenorrhea or a prolonged cycle and ovulation, or whether it's blood stasis with an endometrioma infiltrating into the ovary. Okay, so I'm going to talk about how we organize our thinking process, and I'll give some case examples as we get further along. But we also do have a map here for the Chinese medicine process of treating infertility, and this was organized from lecture material that Dr. Wu gave. Okay, so we know that we want to determine treatment according to the differentiation of the patterns of infertility. So we have that model that guides us. And we know that we need to combine the differentiations of patterns, if necessary, with Western medicine disease identification. I'm just going to minimize my windows here so I can see what I'm doing. Okay, great. And then we have the third. Now this is slightly different from the order in the book, but it's actually how I find mentally it helps me organize my thinking. We regulate the cycle and the menses to treat infertility, and it's hugely important. And it's hugely important in relieving the misery that a lot of women suffer. Okay, and lastly, you can see replenish kidney yang to promote pregnancy. And the big proviso, which I wrote down because it's one of the things that Dr. Wu said, provided there's not too much heat, and we'll come back to that. Okay, so that's how we guide ourselves. Now that's easy to say and sometimes very hard to do. So the mental process of actually guiding ourselves through that is something that I want to try and outline for you today in my talk. Because effectively what we're dealing with in terms of female infertility is a range of factors that actually mean that our work is pretty complex. Okay, so we're looking at the woman, and we're looking at the aspect of diet and lifestyle. Okay, that's somewhere we're thinking we have to intervene in. You can see here male factor. She may have to undergo ART, even though there's nothing ostensibly wrong with her because her partner has a sperm disorder and they can't do anything other than prep his sperm. So she has to undergo the ART, which is a source of some stress, guilt, difficulty between couples. We also have the aspect of, I somehow managed to leave out career here, the aspect of, can you imagine that career is in with age, because they're actually pretty much linked. And I was looking at an older talk of mine, and I saw that 20% of women actually wait until after the age of 35 to have their children. And that is actually a big factor in, it certainly is in my practice. So you have an aging population, women who have had to deal with a career structure, want to get to a certain place in their career structure, and therefore they defer childbearing. And we look at a little bit later, we look at the implications of that in terms of fertility. And we also have family and peer pressures, what it's like, whether it's explicit or unspoken, spoken or implicit, family and peer pressures, and what it means for a woman to either have a well-meaning relative say, when are you going to have a child? Or they see their peers, people in their age group, maybe having one or two children and they haven't succeeded in having a child, and it puts them under enormous pressure, okay? We also have, coming back to what we talked about in terms of our plan, our structure for moving through how to treat infertility, we have to take into account either confirmed or suspected Western medicine diagnoses that are part of our treatment process, and we had that in the second line of our guide, how to plan our way through treating infertility, combine the patterns with any Western medicine diagnosis. And we also have to take into account what kind of treatment previously a woman may have had in an ART setting before she comes and sees us, or before she's actually going to undergo an ART cycle, because that's really important. And thirdly, something I added, which is why my circles are a little bit out of order. Pandemic, what it is to try and conceive in a time when everything's being turned upside down, knowing that at the moment, for instance, partners are not allowed into the birth suite, women are alone giving labor, and that adds an enormous amount of pressure to a woman. Okay, and just very, very quickly, we have to deal with the gamut of emotions that actually that can elicit. And we can see here, obviously, let me start with earth. Okay, so we've got the obsessive overthinking that comes with the whole process of trying to conceive. I've added the stomach there because it's sometimes left out, but the stomach is really important in two respects. There are, in the channel system, the stomach is actually where the impact of internal factors, emotions, lifestyle choices, diet, actually have an impact on mental and physical processes. And that we have that in our own, we can have it in our own vocabulary. They said I couldn't stomach it, it made me feel sick, etc. And the stomach is a channel that can actually be used in terms of calming the mind, like stomach 8, 2A, head bound, or stomach 19 or stomach 21, which can be used to regulate chi along with other points that regulate chi. Okay, so we have metal, grief and loss, which can be a huge factor. Like, for instance, in an ART cycle that didn't work, a woman grieves her embryos, a woman who's had a fatal fetal abnormality, and there's a certain amount of fear and unconscious, I wouldn't say unconscious, but fear, anxiety about conceiving again and having the same thing happen, even though it's like highly unlikely. And the fear of, obviously in water, the fear of non-fulfillment. And then the one we're much more familiar with, of course, with the stress, frustration, anger, and envy that a woman fights with in terms of failing to conceive, and then anxiety and sadness. And I haven't necessarily added a lot of information about acupuncture points for this because I think that's already built into so much of the training that people already have access to that material, but they don't necessarily have access to how to guide themselves through this. So treating for fertility is actually very complex and quite demanding for the practitioner. So we're using and regulating endocrine processes as reflected in the BBT, and we'll come back to that. And we're trying to plant the seed, create the circumstances for conception to occur, promoting ovulation and implantation. And to do that, we regulate chi, we nourish essence, we nourish and regulate body and blood and body fluids. We're also promoting providing emotional support to our patients, promoting their yang shen. I should add in for the practitioner, what's good for the patient is good for the practitioner. We're giving lifestyle and dietary advice. And I add this in because we're dealing with the mystery of conception. And this happens when a woman comes to you and she says, you know what, I got 3 blastocysts and they told me they were grade 1 and I was told a 50% of implantation and it didn't happen. And it's extremely difficult. It could be an issue of, we could say it could be an issue of blood deficiency. We could say it could be an issue of blood stasis. We could say it'd be an underlying issue of kidney yin deficiency, but we can only plant the seed, and we have to navigate our way through the emotional landscape of the patient and try to, and I'm coming back to this point, I'm beating it to death probably, try to help them as best we can while keeping our balance. And I want to come back to how we might do that, and just to organize that series of statements, the fundamental patterns of infertility, the Western, applying them to Western medical diagnosis, regulating the cycle, and then trying to tonify kidney yang, provided there's not too much heat. And it's just a different way of looking at it. And I'm going to look at some case histories, hopefully later on, where I talk to you about how I organize my thinking process in order to keep my thinking clear during all this. So we have the fundamental patterns of infertility, we have the possibility of biomedical or organic disease, and we have the impact of cycle disorders, imbalances of yin, yang, qi, and blood process, which may be caused either by a functional imbalance or by a organic situation, an organic disease in the body, and we'll come back to that a little bit later. And then we have the impact on the individual cycle and the potential for conception. Okay, so we need to know what our theory is and what governs us. So we have the basic theory applying to women, the rise and decline of Tiangui, which is very important when we're looking at the process of aging. So you have a whole population. For me, it was accountants, it was solicitors, it was barristers, definitely after 35, maybe even up to 42, 44, trying to have their first child, and they are working against the background of what we would call the cycles of 7. Okay, so we know it's governed by the cycles. This is Su Wen 1. We know it's governed by the cycles of 7 years. Okay, And we know that male fertility is governed by cycles of 8 years. So we know in a woman, a girl, I should say, not a woman, of 7 years, the kidney chi rises in power, the teeth, the bones, as you can see, the kidney connection, are renewed the second the permanent teeth, and the hair grows longer. Teeth, bone, and hair are considered visible signs of maturing kidney chi. At 2 times 7, sorry about this, fertility, Tiangwei arrives. Ren Mai functions fully while the powerful Chong Mai rises in power. The menses flow downward in their time, and she has children. Okay, so we're talking about the maturing of Tiangwei. And usually, you know, if you remember, those of you who are old enough, we talked, who would have welcomed Giovanni's first book on infertility, and he talked about Tiangwei, and we talked about blood. And obviously the Tiangwei, the visible sign of a menstrual cycle is the girl having her first period. But we look at Tiangwei, not just, if you like, the visible sign is the blood, but we look at actually Tiangwei, what Tiangwei means when it arrives. And we're really talking about the maturing of kidney chi and the arrival of hormonal process, okay? And here we have it, at 5 times 7, the face begins to wrinkle and the hair begins to fall. So at 7 times 7, which is not that far away from 42, the Ren Mai is empty and the powerful Chong Mai, the sea of blood, declines progressively. Fertility dries up, she no longer has children, okay? And what we have here is the body in its wisdom, knowing that blood is connected to the kidneys, knowing that it's an expression of kidney essence, in its wisdom, conserving blood, conserving jing, conserving resources for the remaining years of a woman's life. Therefore, actually, in its wisdom, the menstrual cycle stops because she no longer has the resources to fund it. And this comes as a bit of a shock to women, but we have to remember this was actually formulated in times of an agrarian society where people had a shorter lifestyle. So we can have 20 or 30 years of very productive postmenopausal life, okay? So here we have the cycles of 7 mapped chronologically, all right? So you can see that at age 35, much to women's shock, their fertility is declining, and it declines. You can see what it is at 44 or 46. The likelihood of conception will decline just at the time where a lot of women actually are beginning to think, finally, I've got to where I want to get in my career, and I can now think about trying to conceive. And if they go to an IVF clinic, they go to their doctor, they've been trying for a year, nothing's happening, they're referred to an ART clinic, and the ART clinic say, okay, you're 37, you're 38, straight to IVF, okay? So, and it can come as quite a shock. And our role in that case, if a woman is in those circumstances, is to, as I would say, my metaphor is I get on the bus and I accompany them on their journey as they go through the journey of an ART cycle, okay? So here we talk about the actual particularities of female physiology. And it says here, women are mainly composed of blood. That is, female physiology depends on the production of blood in special ways, okay? Blood is being constantly consumed. All right, so we talk about the demands of blood. We know that we need it for daily process. We know we need it for the combustion of food substances. We know we need it for mental processes. But the actual process of the production and the shedding of blood is what is actually governs the monthly cycle of a woman, and it has particular impacts then. Blood is being constantly consumed, and that means that yin is often, and we would probably say relatively insufficient, say particularly at the beginning of the menstrual cycle after the shedding of the endometrium. Yang is often relatively in surplus, often expressed in symptoms of empty heat, particularly as you get towards the period. And blood gets used by periods, pregnancy and breastfeeding, but also in mental process and daily life as women juggle home and work priorities. And which is why in cycle disorders, if you said regulate the cycle in the menses, both excessive menstrual blood and excessively prolonged bleeding is along with a short cycle, is taken so seriously because they see that blood as a resource that has to be replenished on a monthly basis. That's essential for the integrity of body, mind, and spirit. We know that the liver blood nourishes the heart blood, and the heart blood houses the shen. So if blood is excessively lost during a period, if a woman complains of menorrhagia, it can have profound impacts not only for her fertility, but actually for for the security and the rooting of her Shen in her heart blood, and obviously in insomnia and palpitations and all anxiety and all the aspects that come with blood insufficiency in daily life, okay? And so we have the interplay of essence and Zhang Fu. So we know that the kidney is the repository of Jing, the source of Tiangui. So rather than thinking of Tiangui as just as a visible sign of bleeding of the blood, we actually think that maturing provides for hormonal activity. That becomes, we know that the eggs are lost on a cyclical basis anyway before menarche, but when menarche starts and that hormonal cycle starts up, then the eggs are ovulation, the process of ovulation begins. So Tiangui has matured enough that the girl's kidney energy has matured enough that Tiangui is now available for hormonal activity. Okay, so we also know the harmony of the menstrual cycle also depends on the smooth functioning of the Zhang Fu and the strength of postnatal qi. So we know that we are talking about the function of the spleen in producing blood, the function of the liver in storing the blood, governing the smooth flow of the emotions, the emotions, and the kidney relationship, the foundation, the resources. So we know actually, in Dr. Wu would often say the kidney is the source of blood. We know blood starts in the marrow, so it has a fundamental relationship here in terms of its potential in its crucial factor in reproductive life, which is why we start with the two patterns, kidney yang and kidney yin deficiency. We know that the Bao Mai is the connection of the heart to the uterus and the kidneys. And we know that the Bao Lo supports blood to the reproductive tract. And therefore we come back to the importance of blood adequacy and patency. And just as an aside, they did a study which actually studied the blood flow to the ovaries a long time ago of women who suffer premature ovarian failure. And they found that the blood flow to the ovaries was half of that of a woman who was not diagnosed with excessive levels of FSH, which would indicate POF. And therefore, if you think about that, it actually bears out the patterns of the mixture of deficiency and blood stasis that are laid out as a pattern guide in the treatment of reduced ovarian reserves or premature ovarian failure. Okay, where the actual premature ovarian failure, where the cycle is actually stopped. Okay, so we also know that I talked at the beginning about the interface of our interface with the patient's situation and our interface with Western medicine. And we know in order to do that, we have to be as well versed as we can be in the physiology and in the processes of the reproductive system, the monthly cycle, and in the processes that are used during an various ART cycles. So the best practice combining Chinese medicine and Western medicine, that's probably a little bit misleading because that's not like Dr. Wu where they would seamlessly use Western drugs, but we need to know how to understand the processes of Western medicine and to apply our Chinese medicine as purely as possible. Okay, so, and that's another reason why we wrote that book, so that instead of doing it backwards where we look, let's say we look at immune factors from a Western medicine point of view and we recast Chinese medicine to explain it. What we did was we tried to make it absolutely clear that if you stick with the actual traditional patterns and the fundamental education that you get in the processes of TCM and the patterns that are given to us and the cycle disorders that we deal with, the patterns that govern the cycle disorders, we actually do better by sticking with that either as a solo practice or as a support to the processes of an ART cycle that a patient may be undergoing. So in order to do that, they had the brilliant idea, and a lot of you are going to be familiar with this, of recasting the theories of yin and yang, qi and blood. And that meant that the BBT chart became a primary tool to actually help navigate through the process, navigate through treating infertility and helping us understand how to prepare a woman for an ART cycle and assist her through an ART cycle. And I just want to talk about that a little bit by actually looking at how we can actually see how both systems, you can say we have the Western medicine point of view, we know that we have the hypothalamic, the pituitary ovarian axis that governs the reproductive system, but we also have our Chinese medicine axis. So we know that in Western medicine, we have the explanation of the hypothalamus reduces gonadotrophin, releasing hormones. It stimulates the pituitary to actually act on the ovary by secreting a follicle stimulating hormone. That means it has an impact on the ovary. The ovary starts secreting estrogen. That has an impact on the endometrium. So the endometrium actually has a cycle then of what we call the proliferative phase, begins to build up at the beginning of the menstrual cycle. And we know that then that the feedback, that beautiful feedback system, whereby once the pituitary senses that there's enough follicle stimulating hormone, it switches to the production of luteinizing hormone, and that triggers ovulation. And we know that if the follicle is sturdy, if it's really good, then it begins to produce progesterone, and that governs the second phase of the cycle, which is known as the secretory phase, where the endometrium is secreting all these hormones, getting nice and juicy in order to actually be ready to prepare a fertilized egg that will float up through the fallopian tube and hopefully come in for implantation. And correspondingly, we have the Chinese medicine access that I talked a little bit. We have the kidney, we have Jing. It provides the resources once menarche has arrived for Tiangui, that visible sign. Fu Qinyu said that actually don't think of a period as blood, think of it as water, but he's talking about the actual provision of the blood from the kidney resources, okay, from the interaction of kidney yin and kidney yang. So Tiangui is actually hormonal process, and that feeds the Chong Ren, and then the Chong, and I should have said the Chong and the Ren, and that feeds the Baogong, the uterus. And we know that is the process that governs the actual arrival of menarche. We know that it's the process that governs, okay, the actual monthly cycle. It's supplemented by postnatal resources, because if a woman doesn't eat, she stops having a period. If she over-exercises, she stops having a period. There's not enough resources, so she stops the monthly cycle. So we have that interaction between prenatal, if you like, your trust fund, and postnatal, the current account that funds a woman's daily life. So given that, we know that if we use that Chinese medical access, we can see that at age 49, if a woman she has a blood profile done and her FSH is over 40, that's normal. If a woman is under 35 and she has an FSH level is 40, we know it's abnormal. Something has happened to that access from Tiangui to the Chong, the Ren, to the Baogong. Something might have happened to postnatal resources, and that's where our medicine becomes a really valuable resource in dealing with an abnormal, if you like, reduction of either prenatal or postnatal resources, okay? And sometimes that's why it's really useful to actually, when a patient says to you, and you say, please explain acupuncture to me, or please explain Qigong to me, I actually now, I would say, okay, this is a medicine that has to do with the conservation or the creation and management of the resources of the body. And I would explain briefly, I'd explain Jing, I'd explain Qi, and we know acupuncture works through our use of the Qi system of the body. I'd explain the body fluids and their importance. I'd explain the blood and their importance, and I explain the Qi mechanism of the difference between the liver storing the blood and the liver governing the blood. And I'd say, okay, this is all about the management of the resources and substance also. Of course, I would say that the Shen is a very special, very refined, but it's actually a substance that is actually nourished by the other substances of the body. Okay. All right, so here we have a representation of the proliferative and the secretory phase, and the process of the dual process that's going on all the time under the influence of the hormonal system and of the production of the egg. If you look at the egg, you can see, obviously, the egg is like, it's a seed, okay? It's inside a follicle, so it's swimming in a little sea of fluid. We have body fluids. It's a seed, it has potential. Any potential needs the right kind of nourishment. It needs water, it needs warmth in order to grow. And you can see here the process of ovulation, whereby under the influence of prostaglandins, of that seed is ejected from the follicle and begins its journey up the fallopian tube, hopefully to be fertilized by the sperm that are waiting there in the fallopian tube, and then floats into the uterus. And you can see that the generating follicle then becomes the corpus luteum, which secretes progesterone. And here you have a lovely representation of that dual process, which is also represented here, obviously, by the hormonal profile that we see. And it's what I love about this one is it really is similar to what we have in the BBT. If you look at the next one, which is the, if you like, textbook BBT, which represents that hormonal process in terms of the mapping of yin and yang onto this in order to guide us, because we have to remember that we have our pulse taking, we have our tongue diagnosis, we have our patterns, but we can't actually see, we don't have access to a scanning machine to look at what's happening. It'd be too intrusive anyway. But using the BBT as an essential tool in the treatment of infertility, because we can see here the processes of yin and yang. I was doing my qigong this morning and I was doing my yin yang circle, and I was thinking, this is the sea we swim in. This is the process, the transfer, the continual transformation of yin and yang that's manifested on a monthly basis, just like it's manifested in the cycle of a day, just like it's manifested in the cycle of a year. Okay, so we have the phases of the cycle here. We have the shedding of the endometrium, which is an essential part, obviously, the preparation for a new cycle. And they you know, in Western medicine, they know that if they do a D&C, then obviously they find that fertility improves because they've shed the endometrium properly and the new endometrium is better. Okay, we have the growth of the follicle, we have the relative growth of blood and yin. We have what's called a thermal nadir, where the temperature may drop, but it's the representation of the fullness of yin that actually is transformed into the fullness of yin, and that cycle of yin and yang is transformed into yang. We should have a thermal shift of between 0.2 and 0.5, and then we have the luteal phase, and that allows us to see that this rise of the BBT is that process of 3 to 5 days where the egg is making its way down the fallopian tube before, after, for instance, 3 days after the when the temperature's been up for 3 days, we know then we're in the process of the cycle where we actually then are beginning to look at promoting implantation, okay? Provided, of course, that ovulation has taken place, that the BBT has confirmed it. Okay, and I just want to very briefly talk about why this is actually a diagram that shows, I'm sorry it's in German, but it's still pretty clear, that the process of the monthly process is actually a process that is actually 3 months long, that the antral follicles that actually come into play in the monthly cycle are developed over 3 months, which gives us our period of intervention that we say to our patients, please give me some time to try to correct any imbalances that we may have. Please give me some time to prepare you for an ART cycle where they're going to be generating, instead of one dominant follicle, they're going to be asking you to produce 7. And we come back to here. If we look at what the cycle is, if the cycle is the Chinese medicine, the medicine axis is the cycle of that activation of Tiangui, which results in a dominant follicle, which then bursts and releases its egg. If you have one, that unmedicated cycle is 1. If you think about the process of ART where they're trying to get 13, you can think about the drawing on the prenatal resources and the postnatal resources in order to fund that. And even though they say that there's no impact on ART on menopause age, we also know that it explains what we'd call the law of diminishing returns, where a woman say, you know what, Celine, I got 9 eggs on my first cycle, but I only got 6 eggs on my second, and I got 5 eggs or 3 eggs on my third. And I think, yeah, that's because, you know, they're just drawing on your resources all the time. And it's really important, particularly if a woman's had 2 or 3 cycles, please give me some time to try and build you up and correct. Okay, so here's the essential information. And I apologize if this is too basic, but it's something that may not always get outlined as to what we want to ask, and I did talk about the fundamentals. Okay, so you want to know at what part of the cycle is the woman attending. Okay, so I've given you a calculation, and you can do that. You can do it really rapidly in your head. It'll be very impressive. Before they tell you, you can say, what's the date of your last cycle? And you can say, okay, you're cycle day 13 today. Okay, so, and you know where they are. They're right in the middle of their cycle. Okay, cycle day 19, you know that they're actually into the luteal phase. Cycle day 5, you know that they're just had their period and they're into the post period relative deficiency of blood and yin and the beginning of the building of blood and the resources. Okay, you want to know their period length. You want to know when their last menstrual period and their recent menstrual period, because you want to know how regular is their period, how short is the cycle, how long is the cycle, and actually they'll often give you this. You want to know if there's fertile mucus. You want to know if they're doing an OPK or doing a BBT. You want to know, is there discomfort at ovulation? How extreme is it? Is it distension? Is it bad temper? Is it actual physical pain? Is it stabbing pain? And that tells you something about the actual amount of chi stagnation or possibly blood stagnation that's taking place around ovulation that may be an impediment to the transformation of yin to yang at mid-cycle. You want to know about PMT. You want to know about their period, the volume, the consistency, the texture, and I've got volume in there twice, apologies. You want to know what makes their pain better and worse, and you're all used to this in terms of dealing with dysmenorrhea. You want to know if there's vaginal dryness, which is not, I had to learn to ask this question out loud, so do you need a lubricant is the easiest way. Do you feel dry in your vagina? Do you need a lubricant? That tells you something about what you would say that the resources of Tiangwei, the resources for what called Dai Shi, the fertile mucus that's there at mid-cycle, that a woman is often has to be trained to look for. Or correspondingly, you want to know whether they have excessive vaginal discharge. You want to know whether they have pain in intercourse, because that can be a very important indicator of endometriosis that a woman might not actually say until you ask her. You want to know what her libido is like, and you want to know her medications taken, and you want to know if she's had ART cycles, what the details of the protocols were, and what the outcome was. How many eggs did you get? How many fertilized? What did they get to day 3? Did they get to day 5? And you get as much information as you can. And you want to actually also then get essential biomedical information. You want to know their blood test results, FSH, estrogen, luteinizing hormone, okay, FSH, LH imbalance, that gives you indication of possible PCOS. AMH, is it too low? Is it too high? And also take into account AMH levels, which basically means it's an indicator of ovarian reserve, can be one of the reasons why women get, I'm going to use this term, bounced into an ART cycle before actually you might get a chance to work with them, because an AMH just means you have less eggs in your piggy bank. It doesn't say anything about the actual potential eggs in the next few cycles. And I often say to patients, I did when I was doing a lot of infertility work, all you need is one good egg. You need the right circumstances and one good egg. You're trying to get pregnant, try not to worry too much. But women get bounced into ART cycles because they're told their ovarian reserve is too low, okay? You want to know their prolactin. You want to know your TSH levels, androgen levels, and insulin levels. Okay, so we're going into increasing levels of intervention. You want to know if when they have transvaginal scans, they're looking at the ovaries. Okay, so you have here antral follicle count under 10 is reduced. They want to have a 10 in total, and if it's more than 15, then you're looking at what they call the string of pearls, and they can often see endometrioma. Okay, that allows you, a transvaginal scan allows you to measure the endometrium. You want to know if they've had a hysteroscopy, have they had polyps, have they had a DNC? Because if DNC is done with too much enthusiasm, you can have what's called Asherman syndrome, and you can be doing the most wonderful acupuncture in the world. Likewise for endometriosis, but you don't know that because DNC has been done and the basal level of the endometrium has been damaged, then that the Asherman syndrome means that the uterus is stuck together with adhesions and there's no possibility of actually an implantation and a conception. And it's particularly, so if a woman says to you, I had a DNC and my periods went from being 3 days to 1 day and they're very light, then you might say, okay, I recommend you have a hysteroscopy and check out that there isn't Asherman's, because it's more common than anybody actually really talks about, okay? So we also have HSG x-rays or hycoses to establish tubal patency. And if they had a laparoscopy, well, you know, they're talking about actually diagnosing and treating endometriosis. You want to get the report. And a myomectomy, you know that they've had fibroids blocking possibly blocking implantation. And you're looking then, you're actually looking at laparoscopy with endometriosis or myomectomy, you're looking at the factor of blood stasis, combined or solo on its own, or often combined with kidney yang deficiency, kidney yin deficiency, obviously with liver qi stagnation leading to blood stasis, etc. But you're into a different arena. And you can tell I'm speeding up because I'm looking at the clock, okay. So we're also talking about the difference between functional versus organic disease. So we have a functional disorder. There's no evidence of disturbance to endocrine processes or to the tissues of the body. And so much of what we do, so that's why acupuncture is so successful for gynecology, for so many disorders, because we're actually dealing with functional disorders that they can't explain because there's nothing wrong in Western medicine tests. We know it's a functional disorder. We know it's a disorder of yin and yang, qi and blood, and we intervene and we restore homeostasis. And we help the person move into a state of balance and health, okay? But we also know that we deal with organic disorders. So Western medicine finds evidence of our endocrine disorders and or changes to the tissues of the body, okay? So let's look at an insufficient mid-cycle thermal shift. Functional, we can have insufficient resources of kidney yin or kidney yang. We can have liver qi stagnation impeding the transformation of yin and yang. Or organic, we can have PCOS, we can have luteal phase defect, which is also very common, and you'll read about it in the second part of the book. We can have premature ovarian failure. We can have luteinized unruptured follicle syndrome. Somebody's taking Clomid and you get a lovely big follicle, but actually it doesn't rupture, it doesn't release. So you've got a situation where it looks like they're ovulating, they think they're ovulating, and they're not actually ovulating. So if someone's taking clomiphene, you may be sure that in a good proportion of those cases, they will have a situation where they have LUFS and no actual ovulation, which is why in ART clinics, as opposed to a lot of GPs, clomiphene is used with a HCG injection to make sure that ovulation actually occurs. Okay, likewise, temperature fails to fall with the period. Let's not discount pregnancy. So you could have, instead of a biphasic BBT with 2 phases showing that it's absolutely healthy, you have a pregnancy, you have the third surge, you have a triphasic BBT, and you have pregnancy. Or heat and or blood stasis obstructs the movement of yang to yin. The temperature doesn't drop, cardinal sign in the BBT, and one where you need to negotiate with your patient, because you say, I have to move this blood, and it does mean that in that process, we need to correct something that's actually an impediment to your conception. You need to give me time to do this, because you don't say it's less likely you conceive, because that's going to freak them out, but you do say you need to allow me time to do this, and I guarantee you'll feel better because you'll have less pain, but you need to allow me to do this in order to facilitate the cycle of yin and yang, to correct the cycle of yin and yang that's manifested in the menstrual process. Okay, so that gives us, then to come back to the BBT, it gives us our stages of the cycle, which people are pretty familiar with. The purging of blood, okay, yin and yang have, okay, now declined, expressed in the purging of the blood. And we would also say in Chinese medicine, you need to allow the endometrium to shed, which I talked about indirectly when I talked about a DNC, okay? And that's very important when you're talking about a herbal strategy, when you're talking about managing a period. Okay, we have, after menses, the relative deficiency of yin and blood, and we have the regrowth of yin and blood. The uterus closes and the growth of blood and yin begins. We have the connection yin-yu, di-yu or yin-yun, the connection of yin and yang. Yin reaches peak, yang rises. Yin fullness, the resultant movement of yang allow for the planting of seed of the possibility of conception. Okay, which is often why we use blood-moving herbs as an addition when we feel that actually that movement of yin and yang is not happening in the right way. If you think about the movement of the egg out of the follicle, you think about the movement of the egg through the fallopian tubes. You want to facilitate that movement, and sometimes you use blood-moving herbs or blood-moving strategies in order to help with that. And we have the luteal phase. Okay, sufficiency and fullness of yin, yang grows and peaks fullness in the penetrating and conception vessels and in the uterine vessel, the BMI, and the uterus prepares to nourish a fetus, which gives us our treatment through the cycle. Okay, stages 1 to 5, regulate qi and blood. Stage 2, the growth of blood and yin, relative deficiency, gather resources for the cycle, tonify the kidneys, nourish blood, soothe the liver, regulate qi, calm the shen, promote the capacity for ovulation. Okay. If you have ovulation, obviously, if you haven't ovulation, you continue with the process of engendering ovulation according to your patterns. But if you do, you promote you still do this, promote the transformation of yin to yang as appropriate to the person, and it's always the key factor. Regulate qi and blood to assist with ovulation. If there is ovulation, if there is evidence of a luteal phase, then with evidence of ovulation, stabilize the luteal phase and promote implantation. You treat the kidneys and the spleen, and that's laid out in great detail in the book. Okay, so let's look very quickly at my favorite hobby horse, and I've left this very short, so I might go over it. That's okay. If it's not so, just let me know. But regulating the cycle is recognized as a crucial step in the treatment of menstrual disorders. And those cycle disorders guide us in devising correct treatment strategies. So if you think about cycle disorders in Chinese medicine, which can be the timing of the cycle, which is too short, then too many eggs used, not enough time for that development of yin and yang, not enough time for proper implantation of the egg, etc., or too long, taking too long correspondingly. Disorders of the volume of bleeding, okay, too much blood loss during the period, or correspondingly not enough blood, where we get the phrase, don't overfish the pond, because if there's not enough blood, you need to establish why. Okay, so disorders of the timing of bleeding, which a woman may not tell you. Is there bleeding at mid-cycle? Is there prolonged bleeding? Again, when the proliferative phase should be taking place, is the bleeding going on and disrupting that process? So if we learn how to deal with cycle disorders and we incorporate them into our treatment plan, we're more skilled in adapting our treatment to stages of the menstrual cycle and biomedical diseases. And that's laid out in great detail in part 1 of our book. Okay. And I did this chart to just show you how easy it is, how similar it is, how much of a guide these can be in order to understand the similarities. So if you learn how to deal with the short cycle, you're also learning how to deal with deficiency, with heavy bleeding, with prolonged bleeding, and with where everything, timing, amount, volume, etc., goes wrong when you woman have dysfunctional uterine bleeding, which can be a source of enormous pain and discomfort for a woman. Okay, so once you learn these, then it's actually really easy to navigate. There's some ones where it's a little bit more tricky when you have blood stasis and prolonged bleeding, or damp heat, and if we have time, I'll go through this very quickly for you. Okay, so let's say you have prolonged bleeding, and as I said, you have it going on into the proliferative phase. So your strategy, obviously, in order to create the circumstances for conception, is to control that. It's okay, it's easy when it's qi deficiency. It's a little more complicated when it's blood stasis, because you want to move the blood. But if you learn those strategies, then you can actually deal with that cycle. And likewise, if you've got bleeding at mid-cycle, okay, and it comes from empty heat, and you can say to the woman, we're going to work with this now, but actually in the next cycle it should be better. But it's a little bit tricky if it has to do, there's a lot of damp and heat, and you have someone who has subacute pelvic inflammatory disease, and you're trying to get the movement of yin to yang at mid-cycle, and as Dr. Wu would say, there's too much heat, so you really need to deal with that. So that's a little bit tricky, and it needs some guidance there, and again, that's clearly laid out in the book. So I'm just returning very briefly to the patterns of female infertility. Okay, so we need to know that they coexist, and we need to establish a hierarchy, and we come back how to guide ourselves through this process. Okay, so here we have a very clear yin deficiency tongue. Okay, and we have concurrent blood stasis. So yin deficiency tongue, if there's enough empty heat, will mean there's a short cycle. If we've got blood stasis and our strategy is to resolve blood stasis, that can be particularly tricky, and we need guidance in doing that. But that is not that hard to do if you know how to clear empty heat and move blood and stop bleeding at the same time. Okay, and likewise, phlegm, damp, stagnation. You can see here, obviously, a pale and swollen tongue, but you can also see a blue tongue. So you know you have blood stasis, phlegm, damp, stagnation with blood stasis, kidney yang fails to support spleen yang, the blood is not warmed, and you've got a corresponding picture a mixed pattern that you have to deal with, okay? And I just want to very briefly talk about how heat is a really important factor. Heat, so it can come from career and work pressures, family pressures, ART procedures, which affect the balance of yin and yang. So if you look at here, you see clomiphene, letrozole, Puragon, Menopur, Gonal-f, and cyclogest, crenine gel are all the drugs that are used in an ART cycle. And clomiphene, letrozole, and Puragon are a succession of strengths of intervention but have an impact. Anything that makes an egg grow faster or grow bigger is actually going to have a very strong impact on anything that makes yang move faster, gather itself faster, has an impact on the resources of yin. Okay, we also have the fact that the heat can be coming from the stomach. And we know that in Chinese medicine, stomach and lung yin go to supplement kidney yin. We know that we actually have often a lot of emphasis on cooked warm foods, but not necessarily often on overly drying foods. Like we know already spicy foods like curries and chilies, but not necessarily onions, garlic, nightshade foods like peppers, aubergines, tomatoes, even, alas, for the Irish, spuds, white spuds. And a lot of emphasis, if we have a little bit of time to just go into how to support the patient literally to correct that by having more wet foods. So we need to look out for subtle signs of heat, redness, dryness, thirst, and that can lead also, it can be evident in cycle disorders and heavy periods. So that means we have to be careful, particularly with herbal treatment, with yang tonifying treatment, because once there's a tendency to heat, it can be there as a potential. And I just want to show you this tongue. This is a woman who actually has had 3 cycles of clomiphene and now is letrozole. And I hope you can see how the tongue is peeled there on the left-hand side. It's slightly peeled at the front. You can see the coating in the middle is actually a little bit thin and it's a little bit patchy at the back. And we can see that her yin resources have actually been compromised by the treatment that she's having. So it's very, very important to support her resources of yin, even though fundamentally she would have started off with a pale tongue. It's now there's this mixture of yin and yang deficiency. And this would certainly be more typical of a lot of the tongues that I would see a lot of heat, either from life circumstances or the effects of ART cycles. Okay, so I'm going to just, Sue, you can stop me at any time if you feel like I'm running over time, but I just want to look at some of how we navigate through this, because it's really important to look at what I talked about, how we organize our thinking. Okay, so just here we can see a classic BBT. And okay, so looking at my organization and my thinking, I see it's classic sawtooth. It doesn't disrupt, there's no disruption of the length of the cycle. It's certainly classic sawtooth. And here I can see liver chi stagnation has generated heat. There is no Western medical disease. We have liver fire disrupting the transformation of yin to yang, a sawtooth BBT, and potential anovulation. Okay, so I know I need to clear liver fire, I need to calm the Shen, etc. And you can see over the process of time that liver fire is cleared, and because it's functional, then it is corrected. And this is the 3rd cycle. She's young, she's only 33, and this is her pregnancy. Even though there is a strong, you can see there's a strong aspect still of sawtooth, we have a successful pregnancy. Let's talk about another patient who's older, okay? She's 38, she's trying to have her 3rd child, okay? She has excessively heavy periods and a lot of blood loss. Coming back to the requirements, the actual aspect of blood for women, excessive blood loss as a factor in the loss of essence, okay? So she's Jing deficient, she's spleen and kidney yang deficient, but there is no biomedical disease. So we have a cycle order of menorrhagia, which is actually spleen chi sinking. So blood loss, insufficient essence for ovulation and conception. And my treatment strategy, tonify the kidney and spleen yang, no biomedical disease, so I don't have to take that into account. Assist the spleen to hold the blood, and I might add the kidney to consolidate the kidney, and restore the resources for conception and implantation. Now I just used it very quickly to show you how actually I do that by giving her a period formula, and you notice that's actually from cycle day 25 to cycle day 5. So I have to ask her patients to do that. Allow me to do this with you, because there's a lot of herbs. There are 2 herbs here that we call Move Blood and Stop Bleeding. And I give her, from cycle day 6 to cycle day 24, I give her a formula that actually does also fulfill my treatment strategy of tonifying kidney yang and spleen yang, and also helping to consolidate the spleen and consolidate kidney qi, and helping to restore the resources for conception. And these would be the acupuncture points that I used. Okay, and then after 3 months, then I actually am able to give her a formula. I don't have to give her a period formula, but it took 3 months to get that bleeding under control. And after 3 months, I saw her, I think, in October, and she conceived in April 19. And that was to do with the fact that I had dealt with a cycle disorder that actually meant that she was losing excessive blood and excessive essence during her period. And very quickly, pardon for the fact that this is actually no details of the person, but I use the BBT as a way of showing you how I organize the material. This is a patient that I saw. She had extremely painful periods, and I saw her. Then I broke my leg, and I didn't see her for about 8 weeks while I recovered. And in that time, she actually produced her BBT, and you can see, I hope you can see how high it is, and I hope you can see, because of the yellow, then how short her cycle is. And she had told me her cycle was regular, but you can see here I have a very, very clear sign of blood heat. And I just did out these myself to show you how short her cycle was, how much, there was no evidence whatsoever. So we have blood heat here, so heat has actually shortened the cycle. So you would have a short cycle due to heat. And that's the second one, okay. And so my treatment started, my diagnosis, kidney yin deficiency, liver qi stagnation and fire. I have blood heat and stasis, suspected endometriosis that results in, because and I suspect it's an organic disorder, but it results in short cycle, severe dysmenorrhea, and its impact on the cycle and ovulation. Heat disrupts the cycle. And I begin the process of treating her. Okay, actually my first formula is actually an endometriosis formula for toxic heat and blood stasis. And I just want to make the point actually that I'd given her a period formula in the time that I was away that made a huge difference to her. But as you can see for herself, because it acted as a, if you like, it acted as a corrective to the period, it didn't actually change the dynamic of the cycle, which is really interesting. I wasn't dealing with the constitutional reasons for the blood stasis and heat. I was only dealing with the outcome during her period of excruciating pain, which is very important, but not necessarily actually helping her to conceive, which is what she wanted to do. So then one of my first treatment strategy obviously is to resolve the blood stasis, resolve the blood stasis, correct the short cycle, relieve the dysmenorrhea, and then I understand that in the process of doing that, I'm going to have an impact, because she's young, on actually the flow of yin and yang in her cycle. And this is the process of her treatment. And you can see actually here, even though there's still, day 1 is high, you can see the temperature has come down. And after 3 months, then I changed a different treatment strategy. I still have the same patterns, but then my treatment strategy changes because I've resolved some of that blood heat and stasis has been resolved. Her period's much better. Soothe the liver, regulate liver qi, clear heat, nourish kidney yin and yang, nourish kidney yin to promote the transformation of yang and promote implantation. And I know that an ovulation has been restored. And this is her third chart then, where you can see she actually conceived. Okay, so very, very quickly, I want to talk about what I said to Sue about a fifth treatment principle, because we had 4. Okay, and it actually is, because after 30 years of this work, I realized how hard it is. We need to engender self-empowerment in women, because they're so often done to, because they can feel betrayed by their bodies. So we can give dietary advice. It's really important to try to return a sense of control to a woman, in addition to all your work. It does mean it's more work, but it's really important. Dietary advice to nourish resources. If we have time, I'll just do that very quickly. appropriate exercise to help with stress, make sure they're getting enough exercise. And I would say, and this has become really important to me, meditative movement to relax and nourish. Learn and teach them Qigong. I know it's a lot, but if you can show them, learn and teach them, or tell them to go to someone who's doing Qigong, where where they're in charge of engendering and nourishing their own resources, it's going to actually relieve a lot of stress. It's going to make them feel more in control, and it'll help them. Everybody has to eat. Okay, they may not want to take herbs, but everybody has to eat. And that can be a really important way for the patient to get back to a sense of control. And I'm just going to talk about the book that I use, okay, which you may or may not know about, but I've done up a kind of a PDF for my patients. Now, I'm not doing justice to Andrew because his book is very complex. He talks a lot about SIBO, he talks a lot about Crohn's disease, he talks a lot about healing the intestines, etc. I wanted to give something to my patients that would help them understand how they can nourish their resources. So I gave them something which explains, if you like, the current account. I gave them something which explains the trust fund. I gave them something which explains the way level, the protective level. And I gave them a summary of Andrew's book, where I summarized his advice on how to actually nourish the digestion, the spleen and the stomach here, minding the cooking method being steaming or boiling or braising, the importance of wet foods, the importance of watching it with pungent hot foods and details, the importance of root vegetables, the importance of a meal that involves a grain, that involves leafy, then coming to the next one, the importance of that relationship between the liver and the spleen that governs so much of the menstrual cycle, that actually governs particularly the prevalence of PMT, the importance of eating well to nourish the blood, the importance of eating well to help the smooth flow of qi, and the foods that can do that, the importance of avoiding things that are going to aggravate the liver, okay? And then I gave them details of the foods that are actually really important, the foods that according, of course, you have to tell the patient how to use this material if they're relatively yin or yang deficient, but how they can nourish their Jing resources and also return them to a sense of self-control. And I apologize, I know I've gone 15 minutes over time, but I really also wanted to say this, Yang Shen for the practitioner, because this is hard work, it's demanding work. Okay, so what goes for the patient goes for the practitioner. External support, supervision and peer support. So much about us work on our own, okay? Internally, be aware of our limitations. Don't overextend. Cultivate compassion for yourself and the patient, and a certain level of detachment and embodied movement. I think it's so important for us to keep our keel, to keep our strength, to navigate our way through, as we use the intellectual process to navigate our way. This keeps us steady in our compassion for our patients, so that when we get this, it doesn't come at too high a price for us, and we don't face early burnout in this challenging work. And that's the end of my talk. Apologies for the fact that I've gone over 15 minutes, but I hope that you'll find that I try to include tools that you'll find can be of use to release some of the reliance that a patient has, to return some power to her as she navigates this difficult process. Okay, so now
Thank you, Celine. That's absolutely amazing. I can't believe that you've put so much information into that. That is wonderful. Couple of questions here in the chat box. So if anybody has a question to ask, please either raise your hand or you can put it in the chat box. So one that's here is, do you get all your patients to use BBT charts? This is
when you're actually, yes, the answer is as many as you can. Okay, so you can see, because it does give us insight into what's actually happening in the cycle. It's invisible. It's like we can be doing the most wonderful treatment, but if there's no ovulation, and the BBT chart will show us that, it will show us imbalances, and there's a lot of attention to the BBT irregularities in the book that will guide us. You know, in luteal phase defect, there's a particular BBT. Now, there will be some women who will find it impossible to do. They will just find it impossible to do. But and that, you just have to say, okay, if it's disrupting your sleep, if it's making you massively unhappy, then I reluctantly, I say, okay, don't do it. But the majority of women, if they can do it, it's immensely important. And it allows you to fine tune your treatment. It allows you, particularly when you're using herbs and the BBT, you can say to a patient, if you have someone who's endometriosis, and this is kind of advanced, but if someone has endometriosis and you know they're ovulating, the BBT shows they're ovulating, and you can move blood till, now pardon that, you can move blood strongly as long as you're doing nourishing essence, regulating chi. You can move blood right up until 3 days after ovulation. You can say to them, once your BBT has been up, you can move blood to assist with endometriosis, to assist with myoma. And once the BBT is up, then you can switch 3 days after ovulation. The temperature's been up for 3 days. You can say, now switch to luteal formula, where you stop moving blood, you try to promote implantation. So the BBT is an amazing tool. It is, some women can't do it, a lot of women can, and it will really guide you. If you look at the details of the BBT in the various patterns, you'll understand how to use this material, and it does give a richness to your practice that is invaluable.
Thank you. Another question here, would you give acupuncture to a patient during the period?
Oh yeah, absolutely, absolutely. I mean, if you don't use herbs, how else are you going to regulate chi and blood? Restrain bleeding if there's excessive bleeding? Absolutely. And you can see that when you look at the book and you look at treating, you know, dysmenorrhea, you'll see there are points there for, you would restrain bleeding, you could use the 4 gates, you could use points for like spleen 8, you can use stomach 25, it's going to help with abdominal pain. If someone can't, if there's a lot of pain, you can turn them on their tummies, you can use the points on the sacrum. You absolutely, you use your acupuncture. Now, the reason I emphasized herbs is because that allowed me to actually not see women on a weekly basis. And I could say to them, here's your herbs, here's something you can take during your period. So I could be freed for the responsibility of having to see them. But if I saw them during their period, that's exactly what I would do. And if someone was blood deficient, provided I was doing treatment to actually nourish the resources for blood, I would regulate and move the blood, because if you regulate and move the blood, you want the blood to move in the first 2 days of the period. Allow the endometrium to shed. That's why you don't restrain blood too early with a herbal formula. Okay, that's why you have to negotiate with your patients, because you're moving blood. You want to allow the endometrium to shed. Then you, in those first 2 days, you can do that very well with acupuncture, because it's very regulatory. It's, you know, you have to be careful. You have to know what you're doing with herbs. If a period goes on if it's too heavy, you restrain. If it's too light, you move. If it's too long, you don't want it to be over 7 days. You don't want it to be prolonged. So you want it to be within 7 days, and after that, you want it to stop. So absolutely, very, very important. If someone's bleeding in day 7, you stop that bleeding. It's very important. You want that proliferative phase to take place properly. Okay.
Thank you. So, any more questions here? I'm not seeing any raised hands. So, yeah, lots of thanks here, Celine. Really, people have absolutely loved this. Thanks for your presentation. That your knowledge is amazing. And just to say to people, going back to the BBT, that Nava Carmen's talk next week, the webinar is going to be about BBT, so that'll really help move on from this. So we've got another question here. Yeah, can you use the Ren Mai if someone's pregnant?
You know, Dr. Wu says never use points under the belly button once a woman is pregnant. You have to use your judgment. I mean, there have been occasions you certainly wouldn't use points that are low down. I wouldn't use you know, like Ren 3 or Ren 4. I have occasionally, if I thought a patient really needed in early pregnancy, I've used Ren 7, you know, but I certainly would be very careful. So she's just really careful. She's really careful. So I remember reading, being at a talk where this Western doctor was using a lot of points for fetal growth insufficiency. I'm not saying that quite well. Baby's too small. He was using a lot of points in the abdomen, and she'd be appalled. She'd say, that's really crude. You really want to support those resources, and you have to be careful. Of course, it does depend on the strength of your needling. If you're doing very strong needle technique, I wouldn't use Ren points under the belly button. If your needling, like mine, is fairly gentle, then that okay. But I would certainly be careful. There's lots of other points you can use. But then I'm a cautious person.
That's wonderful. Thank you so much.
Okay, can I just, as a final, I just say, please feel the book is very comprehensive, and it is a wonderful resource, not just for infertility, but for gynecology. And I'd be delighted if there were people here who decided, as a result of my talk, I might think about learning herbs. It gives you such an amazing resource. It's sophisticated, it's subtle, it allows you to treat body, mind, and spirit. You can directly nourish the resources. We work through chi system with acupuncture, but in herbal medicine, you can directly nourish the body's resources of blood, of yin, regulate the blood, calm the shen. It's a wonderful, wonderful addition to your general practice, and it's certainly invaluable in terms of gynecology. Okay, that's my last little ad.
Thank you so much, Celine. On behalf of everybody, on behalf of the British Acupuncture Council, I really want to thank you for being a part of this.
Okay. My pleasure.
And oh, hang on, I've got another question here from Alan. Could you clarify if no points under the umbilicus means no points in the legs, or does you just mean the abdomen?
Oh, just the abdomen. Of
Yeah.
course we use distal points. Invaluable. Yeah.
Yeah, lovely.
Distal, but not
Oh,
local.
and the name of the book somebody has asked, so it's Female Infertility and Reproductive Gynecology, a comprehensive clinical manual of integrated Chinese medicine and biomedicine. That's right, isn't it, Celine?
Right, it's a bit of a mouthful, but it is supposed to be a comprehensive guide. And my particular love was really, really, really clarifying cycle disorders, because that's hugely important in the treatment of infertility. You get it through the Journal of Chinese Medicine. There are publishers and our editors did a huge work to get this. This was 10 years work, but to try and create a textbook that would become, that will be a standalone text to guide people through what's often very challenging and difficult work.
Fantastic.
Yeah, okay.
Fantastic.
Right.
Much needed.
All right, okay.
Yes. So thank you so much, Celine, and thank you everybody for attending. And hopefully we can see everybody next week at same time for Neville Carmen's webinar. So have a lovely weekend, enjoy the rest of it, and see you next week. Bye.